Hi everyone, my name is Blandina and I am a dental hygienist here in England, United Kingdom. Today I wanted to talk about gum disease. So gum disease is an umbrella term that will describe early gum disease, gingivitis, and advanced gum disease, periodontal disease. Gingivitis is really the earliest form of gum disease, and it is, good news, reversible. Gingivitis is when the gums are inflamed, they're swollen, they're a bit red, and they may bleed when you're brushing and cleaning between the teeth. With gingivitis, the inflammation is really just superficially around the gum area. It doesn't go any further down into the bone, into the other structures, the periodontal ligaments, the tissues that help to hold your teeth together. So this is a more superficial form and hence is reversible. If you have advanced gum disease, it means it's gone past gingivitis. It means sometimes when gingivitis has been going on for a long time, there's a percentage of the population that will go ahead and have a bit more advanced gum disease called periodontal disease or periodontitis, which basically means it's now deeper than the gums, it's gone further down and formed some pockets and caused the supporting tissues of the tooth to be lost. So in this video, I really want to talk about how we can prevent gum disease, how we can manage gum disease and stabilize the gums to a healthy condition in between your dentist, your dental hygienist visits. If a patient presents to me with gingivitis or periodontitis, the first thing I do is advise an electric toothbrush. So an electric toothbrush is far much better than a manual toothbrush if you're having problems with the gums. Because with an electric toothbrush, it will do most of the work for you. It will work to remove effectively the plaque more than you would do with your own manual toothbrush and leave your teeth cleaner than compared to a manual toothbrush. A lot of studies have shown that electric toothbrushes remove far more plaque than a manual toothbrush when used correctly. So first thing to do is get a very good electric toothbrush. I'll make sure to leave the links in my description area. If you're looking for a good electric toothbrush, then check the link below. Make sure that you're using them for the recommended time, which is usually 2 minutes, and make sure you're finishing the whole 2 minutes with your electric toothbrush. Advantages of using an electric toothbrush is that it will remove far more plaque than an ordinary toothbrush. For people who overbrush, an electric toothbrush usually will help you prevent you overbrushing, because when you press too hard, most of the electric toothbrushes will light up red and some of the toothbrushes completely stop. So this is a warning that you're pressing too hard on your tooth. Whilst if you're using a manual toothbrush, you wouldn't tell if you're overbrushing or not, which will again cause recession and will cause abrasion on the enamel of your tooth. So first things is first, get an electric toothbrush. Secondly, make sure you're cleaning between the teeth. Toothbrushing alone will not prevent gum disease, will not stabilize your gums because it will still leave a lot of plaque between the teeth. So we want to make sure you're cleaning between the teeth, and there's a number of aids, interdental cleaning aids you can use out there. I usually recommend dental floss. Make sure you've been shown how to use floss effectively by your dental hygienist and your dentist. You want to be able to clean under the gum line between the contact points to remove all the plaque that's stuck between your teeth. The second interdental aid is your interdental brushes. So there's a lot of interdental brushes you can use to clean between the teeth. These are really, really ideal at removing plaque and they're very easy to use. You can have a look at my recommended interdental brushes. Thirdly is, again, you can use a water flosser, but a water floss on its own is not going to be as effective as using your traditional floss and interdental brushes, because it might leave a little bit of plaque around the contact points. Because spraying water in between the teeth, not all the water is going to remove plaque, and plaque is quite sticky. Around the contact points, you might find that some plaque has been left. In the long run, you will carry on getting gingivitis, your gums might start bleeding again. So you need to use your water flosser in combination with your floss and interdental brushes. Fourthly, you can use a mouthwash in addition to all of these, in addition to toothbrushing and interdental cleaning. A mouthwash is used as an adjunct on top of your general interdental cleaning and toothbrushing. So again, there's a lot of mouthwashes that will help bring the plaque levels down, bacterial load down in your mouth, and that will help increase the health of your gums. So have a look at the description on effective toothbrushes and toothpaste, interdental cleaning aids, and mouthwashes that are effective to clean in between. But most importantly is making sure you're seeing your dentist, your hygienist, as they have been recommended to you. For a hygienist, it might be every 3 months, every 4 months, or if you're doing well, 6 monthly. So make sure you visit your hygienist and your dentist. All right, hope you enjoyed the video. Until next time, bye.